folks have touched on stigma a little bit, but I just want to talk about that because I think it's a very real, in Boston public schools, clearly there's lots of support and there's screenings happening, et cetera, but we know that that's not how it is everywhere, even in places very close to here. And I know that because we have a wide audience today, so there may be a real range of who's available, and one of the fears that parents have and that we hear a lot from parents is the concern that their child is going to get labeled, that they're not going to, that the school's going to look at them differently, that they went from being the successful kid to something else. And can you just talk a little bit about whether that's, what to do about that, or whether parents need to be concerned about that, and so.
I can talk about it at a district level and then ask Charmaine to jump in at a school-based level. We know that some parents choose to keep what's going on in their home or their child private, and that's their right and that's their choice. And so there are services that we can refer them through their pediatrician, through community partners. So when an issue is brought to someone at the district level or building level, we can say, here are your choices. This is what we have in school. This is what you could access in the community. So I just want to make sure we're very clear that there is parent choice in the matter of health care, and mental health is a health care. And at a school-based level, you can talk about the options you provide.
And I would just add, it is a parent choice, and I think you never force anything on any parent. And often it's more than one conversation if parents are hesitant. Right? There may be instances where the mistrust is warranted. And so we just, we have to acknowledge that piece. In schools, we, again, my goal and my role is always to maintain the students' privacy. That's my foremost importance. One, there are a number of rules around that regarding HIPAA and FERPA. So there are rules that guide our work, and so we can't disclose anything about a student's mental or medical status without the written permission from the parent. So that's one thing that guides any mental health professional. And so we always, we ask, what are you comfortable sharing? And I really I'm really hold to that. I get a lot of kind of resistance from teachers because they want to know more, and I'm like, it's not really important. And what I've found is often helpful is also not focusing on the diagnosis, but really talking about the behaviors that you might see in your classroom. And that also helps parents and teachers to kind of, that's something that's tangible that they can work with.
I think, we know there's a lot of really wonderful things going on in Boston, in our community, in our healthcare, and in our schools, but by no means have we figured this out. And we still have a shortage of providers. We only have 57 psychologists for our school district of 127 or 28 schools. And I think that, we really also need to say, we are doing the best that we can. And I think sometimes we refer families out and there are wait lists. And so I think it'd be sort of a misstep to say this is something that's easy to access and there's someone in every building. But I think really as a parent navigating the system, and finding out what referrals are available based on your insurance even, and sort of and getting a lot of that information ahead of time and knowing that it is out there and that people can help you navigate.
You raise a great point. We're doing great work with the resources that we have, but I don't know a school that doesn't say they need more support, whether it's urban or suburban or rural or well-funded or not. Every school and teacher says, I need more help for my kids. And I think of the 20/20 rule where 20% of kids will have a mental health need, but only 20% of them will actually get the help. And we know often that help is in schools. So when a parent doesn't want to get help in schools, or a school doesn't have the capacity, that's really a risky time to make sure that the family is able to follow up and get into service and keep with it. So many students, if they're not being seen in school, don't follow through in the community service. They'll go to 1 or 2 treatment sessions and then they'll stop. So it is the power of having embedded mental health service in school, is because the kids come every day and they're there and we can get them that support. But it is important.
We might not ever get them into treatment, and so I think some of the things we've talked about today about more classroom-based interventions, more curriculum in the classrooms, thinking preventatively, so that there's ways that kids, if they get more skills and tools and knowledge, they can actually do better too. And so I think I think we have to think about this in a very comprehensive way.
Absolutely. And I think I'm fortunate to have, I moved, as you all know, out of the clinical realm and into the advocacy realm, mostly because I could see how many of the pieces were broken, even though we have so much. We're so fortunate here in Massachusetts that we have so much, and yet there are a lot of kids and families who are not getting what they need when they need it, where they need it. They're not getting evidence-based treatment, et cetera. And so I feel really fortunate to have landed where I landed, which is both in the government relations office at Boston Children's Hospital, but also as part of the Children's Mental Health Campaign, which is a coalition, and it's a coalition from across the state, and we are working on how do we get more funding? What are the programs that are important? How do we make sure there are reentry programs, which we haven't really talked about, but for the really high-end kids who need to be able to successfully finish school, how do we think about and prioritize and help the state and pediatricians and everyone, hospital systems, pay attention to these issues so that kids can get what they need, so that we can have the 20%, right, but maybe we have 30% of 20% or 50% of 20%. That would be great. So I feel really lucky to be able to take my lessons from being a clinician and also to grab each of you at various times to lend stories and help folks in the state who are working hard on this, folks in the legislature, to really move the agenda forward and make sure that kids are getting what they need.
I'm so passionate about advocacy, so I have to jump in to say, Shelley and I just had an event this week, and we said everyone needs to leave today and be an advocate. So I think it's a really important message we can all leave people with as parents, teachers, kids are the biggest voice for advocacy, but us as professionals, we all need to advocate with politicians and school boards and funders and to say that mental health needs the same parity as physical health, number one, right? And that schools need access to behavioral health services. And I think it's everyone's job to advocate about the importance of that, because when we leave it to just a few people, then folks aren't understanding the impact that it's having on our kids and our families. And so it's all of our job. If we can leave with a message that there are resources out there, and I know Kevin's passionate about that, but that it's all of our job to advocate, that would be a really powerful message.
Can I ask the rest of you if you have final words as we're getting ready to wrap up our conversation here?
I actually, before we do that, I'm going to interject, because I do feel we should talk about what happens if a student is suicidal and they do go to the emergency room, what happens. So I would just want to talk about the different range of services that can happen after that. It could include outpatient therapy for a student that we meet with a counselor week to week. It can include a partial hospitalization, which is a program they go to during the day and then they're home at night, but it builds on their coping skills. And then the inpatient unit, where it's a locked unit, where there's more very intensive and intentional services for students. When students return from a hospitalization, we have a reentry program that allows students to slowly transition back into their school, because it can be overwhelming. You're out of your school for a number of weeks to come back and do the school right away. So I just wanted to add that piece.
So, Ella, do you have last words to?
I think my last words are always to parents and families who are dealing with this, and I've said it already today, just that they're not alone, and that there are lots of families, like I said, like 1 in 5 people around, but navigating the system for parents to take good care of themselves even when they're feeling vulnerable about their child or that it might be a challenging time, like they have to be a strong advocate for their kids. So to get the supports they need at the same time is really...
Yeah, and I think whether we're talking about depression, anxiety, bullying, other factors that contribute to suicidal thoughts or not, whether we're talking about suicidal thoughts or not, I think the stigma is going to be there and the thoughts are going to be there too, meaning we don't have anything to necessarily lose by being able to open up the conversations and change the culture and try to fight the stigma a bit by challenging ourselves to feel more comfortable and having upfront, open, empathic conversations, feeling supported, knowing that there are resources available as well.
I would say take students' statements seriously. We just want to make sure that we are attending to that, and if they're asking for our attention, let's give it to them.
Sure. I would just like to say that schools are really important in addressing behavioral health. So we've made a really intentional effort to build the skills of our staff, to provide a variety of supports at a district level, and we're working very intentionally at building the capacity of teachers to create safe and supportive schools that have a continuum, because we as educators broadly have recognized that kids can't be successful if their social, emotional, and behavioral health needs aren't being met. So it's imperative on all of us as a society to really have citizens that are well educated, but also well rounded and have those skills they need to be successful in life. And so we're very passionate about making sure we have the skills, the staffing, and the resources for the students that we serve. And we all need to advocate